This is the fishing village of Kasensero in Rakai Massacre, where the first AIDS cases were discovered in 1982. Due to the unawareness of what this was, the locals believed it was witchcraft.
HIV entered Uganda through majorly the southern part. So the first case was identified in Massacre at a place called Kasensero.
The slim disease, like it had been named by the locals, is believed to have originated from the Lake Victoria region, later spreading throughout the country.
During that time, because it was a new epidemic, people did not know about it. And we registered in Uganda great numbers of deaths.
What happened then, they introduced what was known as the ABC strategy. A meaning abstinence, B is being faithful, and C, use of condoms.
HIV prevalence in the general population in Uganda increased from 6.4% in 2004-2005 to 7.3% by 2011 and stabilized around 7.4% in 2012-2013. This increase and later stagnation undermined the fact that the country that was once well known for earlier interventions that drastically reduced the prevalence in the earlier years of the epidemic is seeing a reversal.
The prevalence may be high, 7.3, but that may not be a problem. Because that means that even us who are HIV positive, we are living longer. At that time, people died.
The stagnation could be partly due to the high coverage of antiretroviral therapy programs, where the number of people living with HIV enrolled on antiretroviral therapy increased from about 330,000 in 2012 to about 750,000 in 2014.
As you know, in the reports, including the UNAIDS global report, we see that Uganda has not been doing very well of recent. Many countries have reduced on new infections, but Uganda is one of the few or one or two countries where new infections have gone up.
Researchers advise that when one begins to take the ARVs, they should be taken religiously as directed by the doctors, because this is the best way to reduce drug resistance of the virus, which in turn increases one's life expectancy.
We are doing a lot of work on HIV drug resistance. And what we're finding is that among people who are recently infected, about less than 5% already have resistant virus, which is not so worrying. But we have gone into some populations where we have found about 10% of people who are newly infected have resistant virus.
The major reason for this is poor adherence to treatment. A number of people, once they start their drugs, the ARVs, and they feel better, they stop. Or they start taking the drugs intermittently. They take 2 days, then they miss 5 days, then take another week, then they miss. So the more they do that, the higher the chances for the virus to develop resistance.
It is important to note that HIV reproduces in the body so quickly that it can reproduce even within an individual during the progress of infection. Viral resistance occurs when the drug levels in the bloodstream are not high enough to stop HIV from reproducing. Inadequate drug levels can result from missed or incorrectly taken doses, ones that are not absorbed or metabolized properly, or because of interactions that may occur with other drugs or food.
I think for now, the major aim of many of scientists working is to prevent new infections and to find a cure.
And of course, information is power. People must be given information, accurate, current, up-to-date information.
The best way to be safe is to get tested for HIV. If found HIV negative, ensure that you stay negative. If found HIV positive, there is hope. Take your HIV medications as indicated by the doctor without faulting.